Hello and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. I'm your host, Jason Howland. Every day we take an average of 20,000 breaths. Our lungs are one of the largest organs of the body, and they do a lot of work every day keeping us alive. Joining us today on Speaking of Health to talk more about the lungs and some of the health issues associated with them is Dr. Abraham Joseph. He's a board-certified internal medicine specialist at Fairmont Medical Center, Mayo Health System. Thanks, Dr. Joseph, for joining us today on Speaking of Health.
Thank you, Jason. Thanks for having me here today.
Well, everyone has to be able to breathe in order to live, so the lungs, they're a pretty important organ. Let's start out with the basics. How exactly do the lungs work in the body?
You're right, Jason. The lungs is a very important organ. It performs a multitude of vital functions, and breathing is the most important one of the functions. When we take a deep breath, we breathe in oxygen, and when we breathe out, we breathe out the stale air or carbon dioxide. We do this 14 to 18 times a minute, 7 days a week, 365 days a year, non-stop. And to understand more about how the lung functions, we have to know a little bit about the structure or the anatomy of the lung. The main airway or the windpipe, we call the trachea, carries the air from the atmosphere into the lungs. And this further divides into two main tubes called the bronchus to supply the right lung and the left lung. These further subdivide into bronchi and eventually end up in a cluster of alveoli or air sacs where the air exchange takes place.
And those air sacs, those alveoli, are they very small?
They are very small. There are about 300 million of these in each lung.
Wow.
So they are small.
And they take in the oxygen and then put it into the blood?
The alveoli is lined with multiple blood capillaries, and that's where the exchange of oxygen between the lungs and the circulation takes place.
Well, today we're talking about some of the diseases of the lung, and let's start with one of the major ones, which is COPD. What is COPD?
COPD is chronic obstructive pulmonary disease. As the name explains, it's got something to do with obstruction of the airways. Chronic bronchitis and emphysema are the two diseases which comprise of COPD. And COPD is the fourth leading cause of death in the U.S. An estimated 30 million Americans suffer from this disease, and it costs the nation about $30 billion in healthcare costs and also costs related to loss of wages and income.
So it's a very prominent disease across the world.
You're right.
So what are some of the symptoms of COPD?
Usually, during the early stages, most of the patients are asymptomatic. But as the disease progresses, you'll notice you'll have problems with breathing, especially when you try to do some activity. For example, you might be able to mow the lawn in about half an hour, but as you develop the disease, it takes more time, and you may not be able to complete the task which you normally do. And as the disease progresses, you will have problems with breathing, with minimal activity, and sometimes at rest.
Can there be symptoms of wheezing or chest tightness, that kind of thing too?
Wheezing, chest tightness are the other symptoms which you can have with COPD. Mm-hmm. The other symptom is cough. Mm-hmm. You cough and you bring up sputum because of the inflammation and the irritation caused by smoking.
Mm-hmm. So your lungs are telling you something's not right.
Exactly.
So is COPD, is it something that you're born with?
No. COPD is something you acquire. It's because of your habits and environment. The major causative agent for COPD is smoking. When you smoke, it causes damage to your airway and causes irritation and inflammation. As a result, it leads to some narrowing and obstruction of the airways and also to cough and production of mucus and sputum.
So what do people need to do to keep their lungs healthy and avoid COPD? Obviously, don't smoke or stop smoking is probably at the top of the list then, sounds like.
Exactly. You're right, Jason. Smoking is the most important thing anybody can do to avoid or to prevent the progression of COPD.
What is it that the smoke inside your lungs, how does it damage them? What does it do to the lungs?
Smoke is an irritant. It inflames the airways, it irritates the airways, leading to mucus production and obstruction. It also produces some enzymes because of the inflammation, which damages the proteins, the structural proteins of the lungs, thereby affecting the function of the lung.
So obviously then the longer that you smoke, the more damage you do to your lungs, the more your symptoms become, right?
Exactly. COPD and the damage to the lung is directly related to the duration of your smoking and the amount you smoke.
So then, do you see this with patients that are over a certain age?
Yeah, the smoking causes damage to the lungs, and initially the patients are asymptomatic.
Mm-hmm.
So usually COPD presents in the 4th or 5th decade of life. Mm-hmm. And as the disease progresses, you become more symptomatic.
What are some of the dangers associated with COPD?
COPD is a disease which progresses. There's no cure for COPD at this point, but we can do a lot to treat the complications and improve quality of life. Patients who have COPD are more prone to get viral and bacterial infections and can develop pneumonia. So it's very important that you get your flu shots and the pneumonia vaccine. The flu vaccine is every year, and the pneumonia vaccine is once before age 65 and once after age 65 if you've not had one in the last 5 years. In addition to that, smoking is the causative factor for COPD, which can also lead to other diseases like high blood pressure, heart disease, stroke, and also cancers are also associated with patients who have COPD who have smoked for a long duration of time.
So COPD can lead to some pretty serious health complications later on in life too.
Exactly. If the disease progresses, it can put a lot of stress on the right side of the heart, leading to heart failure, what we call as pulmonary hypertension or cor pulmonale. You're more prone to get infections and pneumonias, and eventually it affects your lungs to the extent that you become very short of breath and don't have enough oxygen in your blood.
So what treatments are available for COPD? Is there a magic pill you can take that can just cure it?
We have a lot of options available to treat COPD and its complications. The most important thing is to stop smoking. We always try to ask every patient when they come to the clinic or to the hospital about their smoking habits, and we try to assess if their willingness to quit. And some people are not ready, some are, but we have a lot of options, and we advise them about these options we have to quit smoking.
And will quitting smoking, will that reverse the condition?
It would prevent any further progression of the disease. What damages happen would not get worse anymore.
So besides quitting smoking, are there some other things that you can help patients with that have COPD?
We have different options. We have, first we do a testing and a complete physical to establish the diagnosis and to evaluate the severity of the disease. Most patients who have COPD acute exacerbations benefit from inhalers or nebulizers or the bronchodilators, which open up the airways. Some patients do get infections and have acute exacerbations, then we use antibiotics. And sometimes when they get really sick, we might have to admit them to the hospital and treat them with steroids and IV antibiotics. Patients who have low oxygen and heart failure benefit from oxygen therapy, which we use low concentration oxygen for 12 to 14 hours a day.
And what do you mean by oxygen therapy? So they're getting additional oxygen from a tank?
Exactly. There are certain criteria where patients with COPD benefit from oxygen. Patients who have right heart failure or who have low oxygen levels benefit from low concentration oxygen. We have to be very careful. If you use high concentration oxygen, it might suppress the breathing. So low concentration oxygen for 14 to 16 hours might be beneficial for certain groups of patients with COPD.
So it's helping those patients that the lungs can't quite keep up with getting enough oxygen, so you're giving them a little bit extra oxygen.
We are supplementing their oxygen intake.
So are there any other treatment options?
In a subgroup of patients with COPD, lung volume reduction surgery might be beneficial. Also, patients who have severe disease, who are young, and do not have any other comorbid conditions, lung transplant might be considered. In addition to these options we talked about, medications, bronchodilators with inhalers and nebulizers, surgery, pulmonary rehabilitation is very important. There are studies that have proven that rehab helps in increasing quality of life, reducing complications and hospitalization, and improving exercise tolerance.
And what is pulmonary rehab? What are patients doing that go through pulmonary rehab?
There are designated pulmonary rehab programs, and the staff there are trained to encourage patients to exercise and teach them some training exercises for improving and strengthening inspiratory muscles and expiratory muscles. They also encourage them to start exercising and increase activity.
And that's really the key too, isn't it? Is exercising, getting those lungs working and staying healthy. Exercise is the key, right?
Exactly. Exercise keeps you fit and improves your functional capacity, your exercise tolerance, and in addition to smoking, that is another option, another important aspect of management of COPD.
Well, I want to switch gears just a little bit. We've been talking about COPD, but I also want to talk a little bit about asthma. So many folks are affected by asthma, or they know someone that does have asthma. Talk a little bit about the difference. What's the difference between COPD and asthma?
Asthma and COPD are both airway diseases which cause obstruction. But the main difference is in COPD, the obstruction is only partially reversible when you use inhalers, whereas in patients who have asthma, the obstruction is completely reversible with inhalers. Usually, patients who have asthma are younger. They have a family history of asthma. They have allergic diseases, skin diseases like atopic dermatitis, hay fever, and they may not have a history of smoking. Whereas COPD patients do have a history of smoking, and they are more older patients.
All right, very good. Well, unfortunately, we're all out of time, but a great topic, and I want to thank Dr. Joseph for joining us today on Speaking of Health.
Thank you, Jason. Thanks for having me today.
And just a reminder for folks, Dr. Joseph will be giving a free public presentation on this topic on Thursday, January 27th at 7 p.m. in the main classroom at Fairmont Medical Center, and everyone is invited to attend. Have a great day, everyone, and be healthy.